Around half of the world's population lives on less than $2 a day. Many of these people rely on village poultry to pay for their daily needs. In millions of households, it is the women and children who look after the poultry, and it is often women who have control of the resulting income. This is against a backdrop where in many parts of the world it is unusual for women to have control of the income resulting from the livestock for which they care. Income in the hands of women is important because research shows that women commonly invest profits wisely, spending the money on their children's education, nutrition, and for the good of the household. Village poultry in South Asia is widely affected by Newcastle disease, locally known as ranicate or marudi, a highly contagious disease that kills around 90% of the chickens it reaches. There are approximately 2.32 billion chickens in South Asia, of which 748 million are reared in the villages by women. In some areas, there are over 5,000 birds per square kilometer, and Newcastle disease spreads quickly, seriously impacting livelihood. The most effective way to protect the birds is through vaccination. Excellent, safe, and effective vaccines do exist and are widely used in the commercial poultry sector. However, many village poultry keepers do not know of the vaccine and so do not ask for it. The vaccine manufacturers have also not looked at the villages as a market for their products. The result is that the vaccine seldom reaches villages where there is a desperate need for it. Without the vaccine, the disease devastates poultry flocks. The purpose of this short film is to share information with you about the successful projects in India and Nepal which aim to create and support sustainable supply chains of Newcastle disease vaccine at village level. By protecting poultry, these projects are helping to transform the lives of the people living in poverty. The creation of sustainable supply chains of Newcastle disease vaccine has protected the precious birds of people living in poverty. By dramatically increasing the protein intake and household income, which is then reinvested in education, nutrition, and the future of the household. In one of the pilot projects in Nepal, the survival of the birds due to the vaccine provided the equivalent of additional 9 months of income per household. The projects have resulted in the creation of jobs and sustainable livelihood for community animal health workers and vaccinators, where women have been found to be particularly successful in these roles. The status and confidence of women has also increased by the creation of the vaccine supply chains. There is great potential to replicate these projects elsewhere, and so in this documentary we shall discuss the approach taken, explain the project intervention step by step, highlight lessons learned and the key factors for success, hear from individuals and organizations at different points in the vaccine supply chain, including the end beneficiaries themselves, and consider the impact and the difference made. Not-for-profit livestock healthcare NGO, GalMed, everything it does is implemented through its partners. And so when GalMed introduced pilot project in Odisha and Nepal in 2011, it was through 3 NGO partners, BMPCS and Pradhan in Odisha and Haifa International in Nepal. Thanks to the backing of livestock departments and local district government officials, GalMed and its partners began working in the districts of Keonjhar and Mayurbhanj in India and Arjundara in Nepal, with the key objective of creating sustainable supply chains of Newcastle disease vaccine. At the heart of GalMed's approach is that the intervention must support all the links in the vaccine supply chain to ensure that the appropriate vaccine is available, accessible, and adopted by the village poultry keeper. It is well known that a chain is only as strong as its weakest link, and so GalMed seeks to support wherever this is needed in the chain. The pilot projects have involved market development, training of community animal health workers, and raising awareness amongst the poultry farmers. The key stakeholders in the chain are the manufacturer, distributor, retailer, community animal health worker, and village poultry keeper. The success of the Newcastle Disease Control Program in village poultry relies on the effectiveness of the vaccine and the timeliness of vaccination. There are 2 types of vaccine that are currently used. Lasota for chicks, which is administered as a drop straight into the eye or nostril, and R2B for adult birds, which is administered as an injection. For the vaccine to remain effective, it must be kept refrigerated when stored and transported at 2 to 8 degrees Celsius as it passes along the chain, right from the first point of production in the factory until it reaches the village and is administered. This is known as cold chain delivery. If for any reason there is a break in the chain at any point, the vaccine is rendered ineffective and should be destroyed. Strict cold chain management is vital for the success of any vaccination program. GalMed is supporting the development of a thermostable vaccine which is more tolerant of temperature fluctuations and breaks in the cold chain. Work is also being undertaken with the aim of ensuring that villagers will only need to use one type of vaccine that can be easily administered to multi-age flocks without the need of needles. In the pilot projects, GalMed ensured that the cold chain was effective at all levels of distribution by providing appropriate training to increase the knowledge and capacity of the vaccine dealers, including district vaccine stockists, retailers, poultry cooperative staff, and community animal health workers. The training was conducted with support from district-level animal health officials and trainers. In Odisha, the Newcastle disease vaccines come from the factory to the state-level veterinary vaccine dealer at Bhubaneswar. It is then sold to district-level stockists, from where it goes to the block-level retailer. The retailer is responsible for selling it to the community animal health worker based in a village where the vaccine is stored in a refrigerator. 3 to 4 trained community animal health workers take the vaccine from such vaccine centers in a cool box to vaccinate poultry in the villager's backyard. GalMed is a not-for-profit NGO, but it believes in the importance of each of the participants in the supply chain and that they must be fairly rewarded by making money and benefiting financially. This approach seeks to take the long-term interests of each stakeholder into account so that this results in true sustainability beyond the lifespan of the NGO intervention. At the manufacturer level, the pack sizes traditionally produced for the commercial poultry sector contains many hundreds or thousands of doses of vaccine, unaffordable and impractical to villagers with only a few precious birds. GALMED's intervention has been to work with manufacturers to establish the existence of a market for the vaccine in smaller dose numbers at village level. Poultry vaccine distributors and retailers at district and block level were largely unaware of the potential sales in Newcastle disease vaccine for use at village level. GALMED and its partners have provided additional cold chain training to distributors and introduced them to the community animal health workers to demonstrate the existence of the market.
Previously, vaccines were being used only in commercial poultry farms, but in case of backyard poultry, vaccines were hardly being used. But after GALMED intervention, there is a growth in use of vaccination in backyard poultry. We are also keeping these vaccines in stock. Now, the situation has changed. The mortality rate is less now. Chickens are not dying in that big numbers as they used to have. These vaccines prevented that worst thing. Business is also on rise thanks to the vaccination program. We are selling a lot of vaccines these days.
GALMED facilitated the training of community animal health workers and vaccinators to ensure the correct delivery of Newcastle disease vaccine. This included the correct storage and handling of the vaccine and cold chain management. To make community animal health workers business oriented, they were also provided with entrepreneurship training. This enabled them to see for themselves the demand for the product and an untapped market from which they could make an income and also help fellow villagers to make money.
We do regular vaccination from village to village. This vaccination program is going on from last 1 year and a half. We used to have very less number of chickens, but this scenario has changed. Now each family has about 40 to 70 chickens.
My name is Radhika Subba. I used to have only a few birds and was not interested in poultry business because of the Newcastle disease and the premature death of the chickens. Then I heard about the ND vaccine and NGO that raises awareness of it and enables the vaccination of poultry. Initially, the organization provided me with free vaccines, after which I started to pay 4 to 5 Nepali rupees for each vaccine. Now, I can successfully take good care of my poultry farm and also of others' birds. Many people from other villages are asking me to organize training classes there. In my opinion, more people will benefit if this program can reach more villages.
Women in particular are found to be effective community animal health workers. The success of women in this role has provided them with a monthly income of between 2 to 4,000 Indian rupees, which is 30 to 60 US dollars, and increase their status and confidence.
The impact is tremendous. Very short span of time, within 1 year. These bird mortality are used to be happen twice or thrice in a year, but after this vaccination program, we haven't seen any kind of mortality in this area. That's have added the confidence of these women, and women are very, very happy.
At the village level, the task is to create awareness of Newcastle disease prevention and control in the local poultry population by establishing effective deworming and vaccination regimes. All poultry need to be dewormed 7 to 10 days before Newcastle disease vaccination can be carried out. In order to raise awareness and encourage villagers to benefit from the Newcastle disease control program, GALMED's partners have employed a variety of communication methods, taking into account the fact that a majority of the villagers rearing poultry do not read or write. Awareness-raising methods have included theatrical performances, discussion forums, and demonstrations using wall paintings. GALMED has learned from its partners and community leaders that working with existing structures such as women's self-help groups is one of the best ways to support communities by promoting the benefits of Newcastle disease vaccine. The women's self-help groups can be extremely successful in sharing knowledge, coordinating small loans, and providing a structure through which the benefits of Newcastle disease vaccine can be conveyed to the rest of the villagers.
Due to the arrival of poultry vaccine, my wife and other women in our village have been economically empowered.
I am Padma Soren and I am married with 2 daughters. In the past, many of our chickens were killed by disease, leaving only a handful of pullets and hens. This was hard for us. When we learned of the vaccine to protect the birds, it was a huge relief. Since the birds were vaccinated, none have died. The chickens are healthy and show none of the symptoms of the disease. Our flock has grown again and now we have lots of birds. We have just sold 6 chickens in December and made a whopping 7,200 rupees. With such great profits, we can now afford to feed our birds to make them strong and healthy. In turn, they produce more eggs. By feeding the chicks properly, we are also making them less vulnerable to diseases. The income means that we can afford to educate our children and buy them proper food and decent clothes. None of this would be possible without the money for the chickens. Our friends and relatives relish the chicken curries that we are now able to serve them.
My name is
Kapura Mohanto. I live in Budhikapudi. We first dewormed and vaccinated 40 chickens and were amazed that the vaccine worked and that they didn't at all die as the birds had in the past. The results were wonderful. The chicks were healthy and grew well, enabling us to sell them later and make a good profit. Seeing our success, our neighbors and other villagers decided to try the vaccine too. This year, my son was due to sit for his class 10th examination, for which we needed to pay the fees. We were able to afford this by selling the chickens. We spent around 1,000 rupees in his tuition fees, books and other materials, which is directly paid for by our poultry effort. For us, this is a good source of income. So, we take good care of our chickens, we feed them well and provide them treatment where needed. Although the project began 2 years ago, I have always kept poultry but was not satisfied with my poultry farming. Through project interventions, I learnt about ND vaccination and the correct ways of keeping poultry. This helped me a lot to run my poultry far successfully. Because of increased income, today I am able to contribute to my children's education and the daily needs. I am very proud to say that I have progressed from a small hut to a proper building which was partially funded by poultry income. Now, my family's future is secure. When the project began, I had a few birds and within 2 years I have managed to expand this to a flock of 50 to 70 birds throughout the year. I have made an income up to 2,50,000 to 3 lakh Nepali rupees. This is one of the greatest achievements of my life.
After vaccine and medicine intervention in our village, our poultry production has been improved remarkably. And in the process, my wife is gaining self-confidence. Now she is doing poultry keeping work with enthusiasm. Earlier she used to ask me for money, but nowadays she is earning a good money through poultry and able to meet all her economic requirements.
The supply chain is still functional after the project withdrawal. Not only did the project benefit the livestock keepers, it also created employment opportunities for community animal health workers and economic profit for retailers and vaccine distributors. Veterinarian Dr. Mamta Dhawan, Galvamed's regional manager for South Asia, has been instrumental throughout the pilot projects. and explains the approach adopted and its impact.
When we started the program, we had done a baseline survey, and after around 1.5 years, we again went to the same households to see what has been the outcome of our program. From that, it is quite clear that there has been no ND outbreak all this while, and because there was no ND outbreak, the flock size has increased, which has resulted in more income to the women poultry farmers, as well as the nutritional security of the household has also improved. Now more number of birds are being sold and more number of birds are being consumed.
And Chief District Veterinary Officer for Kionja, Dr. Siva Prasad Sahu, has also observed the success of the Newcastle disease vaccine projects.
More women should be encouraged to get involved in backyard poultry on a part-time basis because it gives them an income of their own.
We delivered efficiently the Newcastle disease vaccines to protect the poultry birds owned by small farmers and women-headed families. The work in India as well as in Nepal made an impact on thousands of families. This is a great success story, and we are looking forward for similar expansion on a large scale in India and Nepal as well.
While there has been success in all pilot project areas, the income increase in Nepal is particularly noteworthy, having increased household income by approximately $450 or the equivalent of an additional 9 months' income. In India, income from poultry was equivalent to 2 to 4 months of income of the household from other sources. Moreover, the consumption of protein in the form of chicken meat has increased post-intervention, since on an average, a household presently consumes 25 to 35 birds as compared to 12 to 13 birds per year previously. The project has scope to expand to other districts of Odisha as well as states like Chhattisgarh, Jharkhand and West Bengal, where poultry farmers face similar situation and can benefit tremendously. Galmed and its partners have contributed by protecting poultry and enhancing the livelihood and food security of the poultry keepers. This is an effective model that could have great impact elsewhere to help transform the lives of people living in poverty, affording them income and the dignity of self-determination.